You are now listening to Extracting Wisdom. Here to help you prevent the decay of your future is your host, Brandon Everett.
Hello and welcome back to another episode of Extracting Wisdom. My name is Brandon Everett and I am now officially on Thanksgiving break. After 2 brutal weeks of exams, I'll be putting an episode out about that very soon. But for tonight, I'm very excited to have on a really good friend of mine, Mr. Zach Lee, who attended Indiana University with me and majored in biochemistry. Right, Zach? Biochem?
That's right. Yep.
And he is now attending medical school in Bloomington. So Zach, welcome to the show. It's awesome to have you on.
Thanks for having me, Brandon. I'm stoked to be here. This is really cool.
Yeah, it's been wanting to do this for a long time now, so I'm glad we're finally getting around to it. And it's nice for listeners not to just listen to me tonight, which is great because I usually do these solo, so it's nice to have somebody else on.
Yeah, it's good to be here.
So just to start off, Zach, tell us a little bit about yourself and how you got involved in medicine.
Sure. So I am a first-year medical student at Indiana University School of Medicine. I am on the regional campus, so the main campus of IU is at Indianapolis in the state's capital, but there's small regional campuses, and I'm in Bloomington.
Right.
I really like it here. So I went to undergrad here, like you said, so it wasn't too much of a change. It really was almost not a change at all.
Well, that's good in some ways.
Yeah. So it's been fun. It's been busy, as I'm sure you and your listeners are aware, and it's been fun. I'm really enjoying it.
That's awesome. Well, Bloomington's where we met. We're roommates. Well, not roommates, but we lived on the same floor, Teeter Boysen,
That's right.
which was awesome. And now we went 4 years of undergrad together, and now we're both at different places.
Mm-hmm.
So tell me, what does a typical day at med school look like for you?
So I really wanted to be able to wake up early. But I'm just not a morning person, Brandon. I'm not. So
that's a little bit different for me. We're opposites in that aspect.
Right. So I don't have class until 1:00 every day. And so I'll usually wake up around like 10 to 11. So that's really nice. I know that not a lot of professional students or, really people after college get that opportunity. So I'm taking advantage of it while I have the time now.
Yeah, absolutely. I would too.
Then I have class typically from 1 to 5. A really interesting thing about IU is that our lectures from both our campus and other campuses are all recorded. So actually, we don't have to attend lectures. We only have to attend when we have like small group assignments due.
Oh, I see. Okay, so all of these lectures are online and it's the same for all of the regional campuses?
Yep. So I could watch sometimes if you aren't really vibing with the professor, for whatever reason it may be. I know like a lot of students will choose to watch other campuses instead of attending a lecture, which it's all based on what works for you. I know some people, like we had a recent exam, and the professor that taught that subject was the course director from, I think maybe Fort Wayne or Terre Haute. So people would like to watch his lectures because they think it might have a little bit more to do with the exam or something like that. So a couple different strategies, but sometimes I don't go to class. Sometimes I do. I go to class more often than not. So that's nice.
Yeah, that's very cool. And how long does this schedule last? Like, will your schedule be like this all 4 years, or does it switch up from semester to semester? Do you know?
So it's pretty much going to be the same for the rest of this year and then my second year. Unfortunately, I think second year classes are from 8 to 12. So
A little on the early side for you, huh?
Yeah. But yeah, it's medical school is basically a lot of lectures your first 2 years.
Right.
They're trying to do more integration into clinical work as early
Right.
as possible. So we have some of that, but it's traditionally just been like 2 years of all lecture. And then your third and fourth year, you do your clerkships and you kind of get a taste of what specialty you may be interested in. So
Right.
it's really this way for 2 years, and then third and fourth year you get in the hospital.
I see. Yeah, it's pretty similar to dental school too. I mean, the first 2 years, it's a lot more classroom and lectures than it is application, but then, the second half, you're starting to see patients.
Yeah.
So, and I know this is obviously for our listeners, this is coming from a medical student, but a lot of this can be applicable to dental school or any other pre-professional program. So Zach, how did you make the transition from undergrad to med school? What do you think are some of the hardest things about a professional program, and maybe what things have you found that are very efficient in helping you deal with the course load and things like that of a professional program?
Well, I think I had probably the smoothest in terms of non-academic things. I had the smoothest transition possible. I literally moved down the road to go to my professional school, so that was nice. It was good to be familiar with the area. I already kind of have like my study spots, on campus. You learn like where you like to be around when you're studying.
Right.
So I already kind of have an idea.
So you like to study outside of your apartment or wherever you're living?
Yeah, I generally study outside of my apartment.
Okay.
Actually, believe it or not, I spend most of my studying time in the optometry school. They
Huh.
have a really nice kind of student center in there, so we'll go in there a lot and study. It's really nice.
Very good. Very good.
Coursework wise, that's the big one. It's not an easy transition, but there's lots of things you can do to better the transition. My senior year, I took, as I think most students do, I took some easy classes. I had an easy workload, so that was a bigger difference than like what it would have been my junior or sophomore year of college
Right.
when I was taking all my beefy classes.
Right.
But it's been fun. I am only actually in 2 classes right now. It's
Same with me.
basically anatomy and then like biochemistry, cell biology, and genetics, I think.
Okay.
So it's not anything difficult, but it's a lot, and that's kind of like the theme that I've heard from a lot of people is that the learning anatomy, learning biochemistry, and that sort of thing. It's not difficult. It's just a lot, and so it's time management becomes the important thing.
Absolutely. Yeah, that's kind of the name of the game. And, dental and med school it's not about how hard is the material. It's how efficiently can you learn all the material that's being thrown at you. Yeah,
Exactly.
I totally agree. So with that, how do you manage that course load? How do you take your notes? How do you efficiently study all that material?
Well,
Because I know I'll preface this too, and I know I've talked about the way I take notes and everything, and I know you're more of an absorber, aren't you, when it comes to information?
so I do a lot of. I don't usually take notes during class.
Right.
So they release the lectures to us like in the form of like a PowerPoint presentation.
Okay.
So I will just usually I will watch those. If I'm in class, I'll just follow along with the presentation. If I feel like it's kind of easier material or something I've already kind of been exposed to, I'll take notes online. I use the basic Quizlet usually for flashcards.
Right.
And it's the bomb. It works really well. So
Yeah.
I'll just like make flashcards for some terms that I'm learning in that class. And that's pretty much all I do during class time. I think I look at the presentations, try to focus on all the little things. And then later, when I come back to it to prepare for the exam, that's when I'll kind of start putting things on paper, or usually that's when I'll make the flashcards.
Right.
So
yeah,
it is different.
I'm glad you
I
said
know
that
a
though,
lot of
because flashcards are huge. I use those all the time too. I think,
flashcards rock.
I think I'm up to, have you heard of that Anki software? Have you heard of that?
Yes. I do
So,
not use it, but I know a lot of people that do use it.
right. Yeah. And I'm a big fan of that. And I think, my deck is now like 1,100 cards or something like that, which is just so much material, but it's so great to have all of that in flashcard form, especially when boards come up and stuff like that. It's so easy to go back and review.
You said you do use Anki?
I do. Yeah.
What do you like it a lot?
I really like it just because it's so, and Quizlet's probably this similar. The two things I really like about Anki is first that it can sync to all your devices. So I have Anki on my MacBook, I have it on my iPad, I have it on my phone. So wherever I am, I can always study, which is really nice. The other thing that I really like is how it organizes what cards come up next. So after you answer each card, there's like four little boxes that appear at the bottom, and it goes through like, oh, that was hard, that was easy, I'm okay with that card. And depending on how you answer that determines how frequently that card comes back. So essentially you're weeding out the cards that you don't know very well. So you're studying what you don't know the most frequently. So that really just drills those things right into you, which is, I find really helpful.
Yeah, no, I know a lot of people that use it, and I've been meaning to maybe, give it a shot. It seems like it just takes a lot of work to make each flashcard.
Yes. It depends on, because you can do different font colors and different types of flashcards with Anki, and you can be as complicated as you want with it. But essentially, that's a form of studying, is making those flashcards. That's kind of how I view it. So typically, and I've said this before on the podcast, but in the evening is when I'll typically make the flashcards. I'll try to make flashcards for the lectures that I had that day. Although sometimes it's really hard to keep on, be motivated enough to keep on top of it. But I'll typically do that. And then in the mornings, since I'm such an early bird, I'll study those first thing in the morning.
Yeah. Well, that's another part of the transition is, when you're an undergrad, those classes are not usually that difficult, and you can get away with, falling behind and then catching up before the exam. In medical school, at least, if you can get really seriously behind if you don't, try to maintain a schedule. And it comes down to working and reviewing every night and being really, aware of what's coming up.
Yeah, that's a great point. It's consistency. You'll find in the more and more people you talk to who are doing well in professional programs, it's not that, they're geniuses or super, smarter than everybody else, because we're all on a level playing field. It's just how consistent are you in your studies.
Yeah, I agree.
So is there any other form of studying that you typically use besides flashcards?
You know what? I am a very basic studier. So I do flashcards. I will rewrite notes on paper, like especially for biochemistry and that sort of things. Right. And the only other recommendation I can say is just some active, learning. So me and my buddy will just ask each other, we'll bounce each other questions off of each other all the time. And then if that subject is a little bit confusing, we will come back to it. We did a lot of work on the whiteboard. So we recently had a biochemistry exam, and that had a lot of, like processes and mechanisms and stuff. So just whiteboard. That's all I use: paper, whiteboard, and flashcards. That's the way to go.
Yeah, I totally agree. And it depends on kind of what you're studying too. That determines kind of the most efficient method. But I totally agree. Flashcards are great, and then to kind of further reinforce what you're learning, it's actively studying, whether that's drawing out mechanisms or drawing actually on physical paper, which, you know, just the motion of you writing that stuff helps you remember.
Right.
But then in group studying too, that's a great way. If you don't understand something, you know, you have tons of classmates to lean on for information. So it's important to remember to use your classmates.
Yeah, very, very rarely do I study alone.
Really?
I have a buddy of mine who, if we're gonna put in a solid, you know, few hours of work, we're gonna usually like meet up on campus or something. But I don't. Yeah, it's easier to be around people that are one, just studying the same things you are, but then you can also like learn about like who has the same study styles and
Right.
who like wants to do the same thing, because not everyone, you know, wants to, you know, be asked all those questions. But
Right.
me and my buddy, we can just like, we'll be quiet for like 15 minutes because we'll be focusing on our own thing, and then I'll just ask him a question. Maybe I already know the answer to it, and then next thing you know, we've been asking questions for like 15 minutes. So yeah,
Right.
that's a very good way to go about things.
Right. Yeah. And it's important to learn early on what kind of learning style you are. You know, I'm a solo learner. So I usually do a lot of studying by myself, but that doesn't mean I don't like working with other people. That's just, you know, how I'm most efficient when I study alone. But other people, you know, they'll grab 2, 3, 4 people and study together, and that works for them.
Right.
So that's just the most important thing is
Mm-hmm.
learning how you learn. So yeah, that's all great. So
How are
tell
your
me,
classes going?
they're going pretty well. I just finished, so I'm on Thanksgiving break now. The last 2
Yeah.
weeks were brutal. I think we had like
Yeah.
6 or 7 exams in 2 weeks. So it was a lot.
How did you have so many exams if you only have 2 classes?
So how my program works is, so we have 2 classes. We have one that is our hard sciences. Now within that class though, that encompasses histology, anatomy, and the hard sciences, all like biochem and cell bio and
Oh, interesting.
neurology and all that stuff. So all of that falls under this one class. So we have that component to our curriculum. Then we also have our clinical sciences. So dentistry is a little bit different in medicine because everybody's going to be using their hands when they graduate. You know, doctors, it's a little bit different how hands-on you're going to be, whether you're going to be a surgeon or, you know, primary care physician. So it kind of depends, but everybody in dental school. So we're going through wax ups, they're called, and we're learning very basic procedures, pouring up dental models and that kind of thing. So we have exams for the clinical aspect of dentistry. And then to tie it all together, we have like small group work. So 2 or 3 times a week, we're put into a room with like 7 other classmates and a faculty member, and we're presented this case. And it's our job to explore the ethics of the case, the hard sciences of the case, like the histology, the anatomy, the biology of it, as well as the kind of the clinical aspects. So it's just a fully integrated curriculum in that aspect. So we had a hard science exam, we had a histology exam. We did this thing called the triple jump exam, which is pretty much small group work, but on a solo level, just to make sure that you know how to go through that process on your own.
Mm-hmm.
Then we had an anatomy exam, a lab practical, and we had our clinical exam as well as some other clinical projects. So there was just a lot going on. So it's nice to finally get a fresh of breath air and get a week off.
That is interesting to think that when all of you guys graduate, you'll be all working with your hands. I've never thought about it that way. That's interesting.
Yeah. You know, I've heard on a lot of other dental podcasts too, what they say is, you know, it doesn't matter if you're the first in your class or the last in your class, everybody's going to be a surgeon when they graduate, essentially.
Yeah.
Yeah, we start fairly early. We haven't seen any patients or anything yet, but obviously we'll get there, but we're just kind of learning the basics of the clinical sciences. So,
That's cool.
Yeah, it's been good. But what I wanted to talk about too is what is the application process like to get into med school?
So, first thing you do is you take your MCAT,
Right.
which is a up to this point is about the biggest exam most people will have taken. It's long. It's a full day, and you got to study for it. Pretty far in advance. Some people study for it a little bit over like 8 months. So it's a serious exam, and people should take it seriously.
Yep.
So I think I took that in May, right after my junior year. I applied in July maybe. But basically, you fill out an application. You select the schools that you want to go to, and then schools will send you a secondary application. All of my schools, I applied to maybe like 12 schools, I think.
Okay.
All of them had secondary applications except for IU, actually. So I didn't have a secondary application for IU, so that was nice and easy. And the secondary applications are usually like essays that they just want to know a little bit more about your character and your judgment.
Right.
So it's pretty easy. It's nothing. Some are harder than others, though. Some have like 3 to 5 essays. So you just gotta kind of prioritize, because it can be kind of an expensive process. I know it's probably
Oh yeah.
similar with dental schools, but it's an expensive process. So you got to be efficient with your time and management. Yeah, but then I got my interview from IU, so that was a fun and exciting and nerve-wracking day all on its own.
So
Um,
tell me a little bit about that. Like, what was your interview day like, and what was your actual interview like?
so my interview was, I went to Indianapolis, and kind of had some information sessions, financial aid, to get everyone kind of warmed up. Um, if I were to give any advice about your interview day, I would say that you should be talking a lot before you start your interview. So I feel like I did not talk enough, so my vocal cords were a little bit cold when I was going into my interview. So if I would recommend, if you're in the car on the way to the interview, sing, put the radio on, call your mom or something. Just when you get there, there's going to be a bunch of other medical students. I think there was, in the group, there was small, like, 20 to 30 or something like that
Right.
this time. Probably more, but converse with them. They're going to ask you a lot of, naturally, they're going to ask you a lot of the same questions that the interviewers are. So they're going to, where are you from? So it's good practice to just talk. So just talk. That's my biggest recommendation. But
That's
yeah,
that's great advice. That is, I haven't really thought of that, but a lot of interviews are early in the morning, so you're just waking up and a little bit groggy. So,
yeah.
um, yeah,
And
that's
then
great.
obviously you want to, practice, some questions. There's, I think I have a book that's just like 1,000 possible medical school questions. And you just want to be able to, you don't want to like sound like you have stuff memorized, but you can imagine that they're going to ask you like, why did you get into medicine? Some other things. You should have, just in the back of your mind, you should already have a story about maybe like a time you worked in a team, or a time you had to use some like judgment or something like that. So you should have those answers in the back of your head already, so that you don't have to sit there and think and go, when did I like mess up and then have to fix it? You
Right,
should
right.
have those. Um,
Yeah,
so my
no,
interview was.
I was just
Go
gonna say
ahead.
I agree with that. That's you want to have those answers definitely in the back of your head and be prepared, but you don't want to sound overly rehearsed.
Right.
You want to sound, you got to make sure you sound genuine in those types of
Right.
situations, because if you sound too rehearsed, it might not necessarily come off as
Right.
genuine in how you truly are as a person. So, but yeah, I totally agree. You got to be prepared for those types of questions.
Yeah. But interview day was really calming, really relaxing. The interviewers, were nice. It was really a conversation. I feel like that's what most medical schools do, and most professional programs. So don't be stressed going in there. Just be yourself, have a conversation, and it's going to work out, really well.
So
Um,
you weren't grilled at all? And you didn't get any tough questions? It was more.
I don't think so. No, I got well, I did get caught off guard a little bit because they asked me a very, very specific question about I use core competencies.
Okay.
And so you always want to be familiar with the program that you're going into. And I had actually heard early in the morning that they were asking these specific questions.
Okay.
And it was like, what do you think about our competencies? And there's 5 of them, and I know them now like the back of my hand. But if you didn't look, you could kind of dance around the topic and say, oh, I think they're good, but it's always better they were looking for hearing some of the actual, terms in the competency. So that one I could have done a little better had I done a little bit more work beforehand, but it's hard when, you're preparing for other interviews or if you still have things going on. So that was tough, but no grilling. It was a conversation. We talked about Indianapolis. We talked about, just normal things. It was very nice and very relaxed, and it was a good time.
Yeah, that's great. And I had very similar experiences with all of my interviews. There's only one school, which I won't name, but there was only one school where they really grilled me. And they asked that I'll never forget. The question they asked me was explain explain why foreign aid is explain why foreign aid is a failing Western philosophy. That was the question that they asked me. And so if you're ever asked a question that you don't immediately know, it's okay to take a quick pause and take a breath and just
Absolutely.
give it your best shot.
Absolutely.
A lot of times they want to know how well you can think on your feet and how well you can communicate under stressful situations, because that's something that physicians and doctors are going to have to do. They're going to have to communicate well under tough situations and tough circumstances. You might have to deliver bad news to a patient, and they want to know that you're a good enough communicator and empathetic enough to deliver that news in the proper way.
Yeah, and that's kind of the core of the interview, is that
Absolutely.
they just want to hear you communicate. They want to know that at the same time they know you're intelligent, but they want to make sure that you're also human as well. So that's good advice too, to just take things slow and that's a tough question, man. That would be intimidating. I'd be like, whew.
Oh, I know. And he asked me, he kind of followed up after that question and said, well, what do you think what do you think about what's going on in Puerto Rico? And and I don't know how I thought of this, but I said technically it's not foreign aid because Puerto Rico is a U.S. governed state. And he said, you're the first person to say that all day. I have no idea how I came up with that. Sometimes sometimes you're amazed with yourself on some of the answers you come up with, but
Impressive.
Keep up with your current events, especially too when interview times come around, because you might get a question about something going on in the world.
Mm-hmm. And more importantly too, if you don't get a question, you can just tie things in and sound like you're culturally aware, which is a very important philosophy as well.
Right. Absolutely.
But yeah, the interview was fun. It was good. IU was a school that I knew I wanted to go to, and I love it here. I really like IU, and medical school is a lot of fun.
Awesome, man. Well, do you have any other last bits of advice for any pre-dental or pre-medical students listening?
I think you just got to, make sure you're staying on top of your lectures. It's easy to fall behind. It's a lot of material. But then at the same time, have fun. I know we just got together. We went to a wedding in Chicago. So it was fun to take a weekend off and just kind of, regroup and gather myself. So have a good time. Don't be too, don't spend all your time studying, because,
You'll go insane.
yeah, you're gonna burn out, and it's just you're not gonna have fun. You're not gonna enjoy studying. this, really complex human body if, you're just exhausted. So have a good balance, and it will make things a lot easier.
Awesome. Yeah, I think that's great advice. Well, buddy, thanks for joining me on the podcast. I really appreciate it.
Thanks for having me on. I'm stoked to do this. It's always a good opportunity to talk to some future healthcare professionals, and I recommend medical school and applying and studying hard. It's been very rewarding, and I'm having a lot of fun.
Absolutely. All right, Zach, thanks so much for being on the show. I appreciate it, and we'll catch up again with you soon.
Absolutely, Brandon. Thanks for having me.
Hey, absolutely. Take care.